it's Erin, and we're here at Stafford Pharmacy and Home Healthcare again with Igor Shaskin, and wanted to talk a little bit about some of the stuff that we're able to do at the pharmacy that maybe you aren't aware of.
Most people think of, our traditionally pharmacy are product related.
Right.
So we dispense meds, and certainly that's still an important part. But since about 2009, the scope of practice for pharmacists has been expanded in Alberta, and certainly we lead not just Canada, but North America and some parts of the globe as far as that type of practice setting or practice scope. So we can order diagnostic tests if it's necessary, such as the traditional lab work. But as far as our true value to patients is the services we provide. Do things such as med reviews, so we review medication profiles, because it's not enough just to accept that the patient's on a particular drug regimen and we just forget about it. As well as we can do a larger scope, such as care plans. So if a person's asthma or diabetes is not really well managed, the pharmacist can go over the regimen, lifestyle, that sort of thing, and make some recommendations as far as some changes in approach, as well as do follow-ups. We're doing a lot more vaccinations, flu, COVID. There's additional vaccines that have been transitioned from public health to being available in pharmacy, such as pneumonia, Prevnar, RSV, tetanus, Tdap. Those are things that are now available through the pharmacy.
So you're not replacing our doctor, you're just, there's clearly a doctor shortage, right?
Yes.
You are stepping in place, right?
Yep.
It's a huge relief to be able to find somebody who can help in a moment. I have used a pharmacist to help when my kid had a cough, and it turned out to be strep.
You're right. I don't want to be somebody's physician. Physicians are still the diagnostic experts, but certainly we fill in that gap, and certainly with the shortage of physicians, hopefully what we provide as services can sort of help leverage the physician's time with patients who actually need their services.
It's been a huge help. I was actually shocked when you said that this has been going on since a lot farther back than COVID, because I thought that the pharmacies stepping in, the pharmacists filling that gap was something since just COVID. But you saying that Alberta has been leading for many, many years prior to that, that's incredible. That's amazing. I feel very proud. And I have nothing to do with it.
No, and certainly I think Albertans should be proud of the fact that we have sort of the most, the best reputation as far as pharmacist services, and we've been fairly progressive. But we've worked hard to do that, and it didn't happen overnight. And hopefully, it'll continue to expand some of those services.
Work together with a team of knowledgeable staff and experienced pharmacists with plenty of services to offer. Visit the Stafford Pharmacy and Home Healthcare team today. 1475 St. Edward Boulevard North and online at staffordpharmacy.com.